back to the Dish on Aging. This is episode 10, and today I will be answering the question, how has the healthcare system changed during this pandemic over the past year? I'll be starting with a review of the vaccination distribution process this past week in the local Bucks County, Philadelphia, Montgomery County region. Today is February 28th, 2021. Okay, so I'm going to start with this very active week with the COVID distribution, new information coming in. I can sum up this week's events with four concepts. The first one is inconsistent distribution. A lot more doses are on the way to Pennsylvania. This could take a while or maybe not for everyone to get vaccinated. And I learned this week why it is so very important to continue to wear your masks even after you're fully vaccinated. So I'm going to go through each one of those points as quickly as I can. So the first task is inconsistent distribution. So what that means is I've been hearing this week about people going to New Jersey. They live in Pennsylvania. They're going to New Jersey to get shots. I'm hearing people tell me that younger family members, meaning younger than age 65, who fall into no risk categories, are getting vaccinated at work. Also, as I mentioned last week, City of Pennsylvania is starting the age 75 and older. Whereas I think the standard in the state and most other counties are going age 65 and older. Also, Philadelphia County, there was a news report, Philadelphia County is vaccinating the 1B group, and we still have a lot more people here in Bucks County who are in the 1A group that need to be vaccinated. I have a feeling the city of Philadelphia also has a lot of people still in that 1A group as well. So things are very, very inconsistent, and people are seeing on social media, talking to friends and family, that people are, I think it's good, they're saying they feel comfortable that they've been vaccinated, but I'm going to give you some numbers from Bucks County. Most of us have not. And so just be aware of that when you're celebrating your vaccine, that you've been vaccinated. That's very important. I want everybody to get vaccinated. I want everybody to celebrate. Just be careful at how happy you are around other people who feel like they're the only person in the state and the county who has not been vaccinated, even though that is not at all true. I'm going to give you some numbers on that a little bit later. So more doses are on the way. This is so very important that there was a news report that this week there will be almost 250,000, 225,000 doses are going to be delivered to the state of Pennsylvania. So that is fantastic. Also, there's some news reports that by July there's going to be something like 5 or 6 100 million doses going to be made available throughout the United States. So that's all fantastic news. And also, drum roll, yesterday Johnson & Johnson's vaccination was approved. So that's the one-shot dose. And I don't know how soon that is going to be getting to these distribution sites. But it means now there are going to be 3 options to get vaccinated with. So more doses are on the way. This could take a while or not. I was listening to a town hall Representative Brian Fitzpatrick had Tuesday night related to Bucks County, a little bit into Philadelphia County. There were local infectious disease experts on the call, also the Bucks County leadership. What Bucks County did, they're recognizing that there are a lot of people anxious about thinking that they're the only person in the county not getting vaccinated. So what Bucks County did, I think it was by Wednesday morning, through the Bucks County um, Department of Health website, you can find out where you are in your list. Now, I jumped to that list because I thought I was going to see my name. You don't see your name. What you see is the total number. So here in Bucks County, there are 150,000 people who are registered with the county who are in the 1A group only. They also list the 1B and the 1C. So if you're in those groups, go look to see what your number is, because I'm in the 1A group as a healthcare provider. So that's what I was focused on. So 150,000 people are registered for the 1A in Bucks County through the Bucks County sign up. And guess how many they've processed so far? 12,000. 12,000 of 150,000. And that is only in the 1A group of Bucks County in Pennsylvania. So it could, when I first saw that, I said, well, it's no wonder why they're not calling me. Although I'm hearing of people getting vaccinated, it is very, very few people. Okay, we're down like 11,000. We only have 140,000 more people to go. And that's why it caught my attention that Philadelphia County has already gone to the 1B list. I think my guess is I think Philadelphia's county is trying to vaccinate the 1A list and the 1B list at the same time. Other good news is that FEMA, which is federal, is opening up the Philadelphia Convention Center. They're trying to target those people who rely on public transportation only to get to appointments. It's primarily going to be Philadelphia County. And I don't know if the doses they get there count in the 225,000 that are coming to the state, but that's going to be another option. So even though it seems like a lot that they're at about 11,000 applications have been processed out of the 150,000 in the 1A group in Bucks County alone, here's what I think is going to happen. I think we're going to start moving very quickly through that list, because think of everybody that you know that lives in Bucks County that got in a car for somehow they could do it and went to New Jersey and got fully vaccinated. Anybody who lives in New Jersey and has not been able to get vaccinated and is in the 1A group should probably be upset about that. But separate from that, we're hearing stories that people who live in Bucks County are getting in the car, going to New Jersey, getting vaccinated. We're also hearing, if you'll remember a few weeks back, people living in Bucks County are getting in the car and traveling, an hour and a half, 2 hours away to get vaccinated. They're going outside of the county. So the good news is that everybody that we've heard that has left Bucks County and lives here to get fully vaccinated, their names may still be on that Bucks County list, and so we might start going through the list very quickly. So because there may be a percentage of those people on that 150,000 resident A1 list that have already been vaccinated. So also we're expecting an influx. So keep an eye for your emails if you requested when you signed up to be notified by email, or keep an eye for your phones if you requested to be notified by phones. A lot of seniors had other family members sign you up. It'd be a good time to check in with the other family members to ask, are they emailing you or me or both? Are they going to call us? And so on and so forth, so you know what to expect. Also within Bucks County, they're sending out the emails. They are then giving you somehow an invitation to sign up for an appointment. Your appointment schedules are the next week. I spoke several weeks ago how sometimes it was, we got something for you this afternoon, take it or leave it. It's much more organized now as it goes through the Bucks County list and the Bucks County Health Department distribution. At the same time, the hospitals and the pharmacies and all those other, I don't know how many hundreds of sites that are out there are still functioning, and their numbers are different. Then people are probably on both lists. They're probably on the county list, and then they were able to go to a supermarket or a pharmacy to get vaccinated. So those vaccinations are also going along. So if you're not on the county list, go to the county list, no matter what county you live on, and that'll be kind of your I don't know, your backup, your sure and steady to get a vaccination is what I'm going to call it. And then, of course, if you have any family members who are real good with the internet and want to, I call it a game of whack-a-mole. You got to be really adept at using the computer, going on and finding out who has, not where the sites are, not where the vaccination sites are, but who has the vaccinations that you can schedule an appointment to get one. So that is pretty sophisticated. I don't think anybody should take the time to do that. I think we should just wait until the county contacts us to go down. So that's the summary of the county. Also, something that I learned this week. Remember, it's only been a year we've been dealing with this COVID. I know it feels like longer. Um, Something that sort of came to, I don't know, my attention this week. I had this idea once I got fully vaccinated, my life was going back to normal. And then a listserv, I'm on a listserv, which is email connections with everybody who does the work I do, psychologists who practice in long-term care. I've been providing all that care by video for the past year, and I intend to continue that for a while. And one of the psychologists made a passing question. Okay, so when is it safe to take off our masks after we get fully vaccinated when we're going into the nursing homes to provide the psychology service? And somebody says, oh dear, do not take off your mask. Also, they're continuing to COVID test every week because anecdotally, what we picked up, anecdotally, I mean, this is not science, these just might have been one-time situations and not part of a trend or anything. Nursing home residents who have been fully vaccinated, means the 2 doses, several weeks go by, there's a new outbreak in the nursing home. They're testing positive, key here, with no symptoms. So then the nursing home residents have to be relocated to another area of the building, so it is inconvenient. When the staff is testing, again, after being fully vaccinated, and then a few weeks go by, re-exposure, testing positive with no symptoms, they then have to work from home for the next 10 days. So what I am seeing anecdotally, not necessarily widespread, but after people get fully vaccinated, if they are re-exposed by somebody who is actively vaccinated, they're testing positive with no symptoms. That means the vaccinations are working. So nobody's having to go to the hospital, nobody's dying, and that is a really good reason to get this vaccination. But what's happening is person's still positive, so there is the disruption in the life that comes with a positive COVID test. So keep that in mind. Um, Okay, so keep those masks on. And what I was hearing this morning with the doctors talking about, if once you get fully vaccinated and 2 weeks have gone by, you can invite your family over who have been fully vaccinated. Um, have them inside without masks. It's just you're not going to be able to go out in public without masks. And also, I can guarantee you, every single healthcare setting you go into, every long-term care, every senior setting, you're going to have to wear your masks because they're continuing to have ongoing outbreaks in long-term care. And there's probably going to be more public discussion about that and why that is. So I learned very clearly what everybody's been talking about with these vaccines for the last several months. They are designed to reduce serious illness, to reduce hospitalizations, and to reduce death, and that is happening not just here in the United States but worldwide. And at the same time, some people who are fully vaccinated are getting re-exposed, testing positive. We also don't know how many people out in the community that are not getting tested every week, like healthcare providers and nursing home residents are, who are direct care healthcare providers. Because I'm working from home, not seeing any patients in the same room, I'm not being tested every week. In fact, I've never been tested. So let's just kind of word of caution, keep your masks on even after you get those shots. And we are moving forward with those shots. So to sum it up, distribution is inconsistent in terms of where do you live, where do you not live, and where you fall on the list of priority or don't. Um, it's inconsistent on who's um, getting the shots and who's still waiting. I think that's going to be just the way that we move forward. More doses are on the way, and that was independent of the Johnson and Johnson third their first, Johnson Johnson's first, so it'll be now a total of 3 vaccinations that have been approved. And this could take a while because here in Bucks County we're up to 7,000 out of the 150,000. So we've got a lot of room to go, but we could start moving very fast through that list. And remember to wear the mask after you've been fully vaccinated. That is going to be very important to continue to keep yourself safe until we reach that point. when everybody in the room with us has been fully vaccinated. Then we're going to be able to take our masks off. Oh, one other note, I saw a news report, they are going to start opening senior centers in Philadelphia. I don't know when. I've heard nothing about Bucks County or Montgomery County. The stipulation in Philadelphia senior centers that are opening, no more than 25 people per room. Everybody's going to have to go in with an N95 mask or double masked. I double mask when I'm in the supermarket. Oh my goodness, anybody with a breathing problem might have a problem with that. I also don't know if they're going to be starting up with the lunch program right away. I just don't know what their plans are. But I am so glad to see that, and I'm looking forward to Bucks County senior centers opening up as well. Those are so important to get some of you out and about during the day. Okay, so that's the summary of the update for vaccination distribution. Now to the question of the day. How has the healthcare system changed during the pandemic? I've come up with five items that I have observed. I will list them and then I will go through and talk about each. First of all, there's a lot more telehealth services being provided. And oh my gosh, the chaos in the healthcare system, just trying to if you ever had to go to the hospital in the last few months for a procedure, or you had to go to the emergency department, or you've got a doctor's office, you cannot get anybody to answer the phone. There's some offices, not every office, not every hospital, but the healthcare system is a bit chaotic. Some providers are not able to return to work full time after COVID, not because of the COVID. The COVID made its rounds, their immune system took care of it, but then probably because of their age, over age 50, after the COVID, they then had a new debilitating medical diagnosis, maybe something with the heart, the lungs, whatever it was. So I'm hearing anecdotal reports from my patients about that. Some of the doctors are able to return part-time, some are not returning at all, and those are the doctors who are telling their offices, it's okay if you tell my patients that I have this new medical diagnosis and it's whatever it is, and that's why I'm no longer able to provide them care. We don't know how many providers are making a decision to retire early or just to step back from work without saying why. So COVID is impacting the healthcare provider numbers out there. Significantly fewer families are using long-term care facilities for care. And fewer people are seeking, oh no, a lot of people are seeking a lot less health care, routine appointments, screenings. So I'm going to go through and talk about these five topics, and then I'm going to go through and talk about topics for March of 2021. I have a theme for my videos for March. The theme is going to be, I want everybody to take action to restore the quality of your daily life. Um, I'll take the time. I'll tell you what the topics are going to be. March 7th, which will be next week, episode 11. Putting it while waiting for full vaccination, what to plan in terms of out of the house activities. March 14th will be while waiting for full vaccination. Why is it important to continue to expand internet social connections? March 21st, while waiting for full vaccination, how should I begin to think about my future in-home care needs? And March 28th, while waiting for vaccination, what can I do to help reduce the caregiver burden, um, experienced or not experienced, by my family members who are providing me with help during this pandemic or just because of health-related concern? So again, the general theme that I'm going to be applying with all of these topics through the month of March are things that you can do to take action to restore the quality of your daily life. This past year has dragged on too long, and we've got too many people who are just feeling really down and just really down in the dumps, and their health is suffering, their mood is suffering, their quality of life is suffering. We also don't know how long some of us are going to be on that AWIN list, particularly here in Bucks County. Um, I guess we can be hopeful for June or July. I don't know. Also, keep in mind, The vaccinations have only been approved for those age 16 and older, and it's probably not going to be till 2022. I don't understand the pediatrics because I specialize in geriatrics, but pediatrics, they have to do further testing for these vaccinations to make sure that they're safe with the children. So those of you with grandkids, great grandkids, keep in mind they probably will not have access to vaccinations. And I'll be talking about how you can still spend time with them outside this summer with them wearing masks, even and probably you wearing a mask, even though you've been fully vaccinated. That'll be in the weeks to come. Okay, so back to the original question of today. Much more telehealth care is being provided, and that came up. It had already started before the pandemic, particularly Medicare. I'm talking specifically about Medicare plans. It had started to trickle in a little bit. The healthcare system, the healthcare payer, particularly Medicare, is very slow to take in new concepts. When the pandemic hit, it just took an act of Congress, quite literally, that's what it was. And they just went through like 12 policies, and they 12, actually probably 1,200 healthcare policies related to Medicare billing. And they said, we're going to waive all these and we're going to bring these in and start up with the video or the telephone health. This has worked so well. Telehealth will continue through the pandemic, and it's also going to continue after the pandemic. So healthcare has been forever changed. You will still be able to see your doctors, your healthcare providers in their offices after the pandemic. I don't want anybody to think this is the new way, but this is going to be, I think, a really good option or choice. Um, Less of an issue here in the Philadelphia region. If you live out in the middle of Montana and you have to drive 2 hours to see a healthcare provider, that's really where it's going to have an impact. And I think it's going to save transportation headaches for those of us who live locally here. Now the issue, yes, the chaos of some hospitals, some doctors' offices, just the things I've heard over the last few months, actually really the last 6 months, curl my hair up. Things I've never heard happening in healthcare. Things like a senior goes into the emergency department, gets whatever the problem is straightened out, goes home. Family can't come in with them. Might be someone that's used to always having a family member with them. Get home, starts reading the paper, sees a diagnosis they've never seen before, and starts sobbing for 2 days because they think they have a new diagnosis and somebody in the family, oh, I think they have to go for a test and they know nothing about it. And this is how it all began of their loved one who died 2 decades ago. And so they now believe they're dying. And then I've never heard of this happening before. So I'll explain to the person, let me tell you what I think's going on to create the chaos. These healthcare systems from the get-go, if you show up to work and your COVID test from yesterday came back positive overnight, that means that your team at work is now working without you, and they probably don't have an opportunity to pull anybody in to fill your shoes. So then everybody who's left is just trying to juggle the balls. So um, that's probably adding to the chaos. Um, Also, yeah, so it's just really chaotic. I had trouble with one of my providers scheduling an appointment this summer. Every time I scheduled the appointment, um, I'd scheduled like 2 weeks in advance, and this is important because during the week I have my own patients I schedule, so I'll take a block and I won't schedule my own patients, so I can go to my own medical doctor, and then the day before they cancel, and that happened twice. And this is a practice I'd been going to for more than 20 years. It was time for me to find a new doctor, and I did. And they had Saturday appointments, weekend appointments, so it was a real positive experience. So I don't even know what was happening over there at that practice. I don't know if the providers, like I said, it could have been one of these situations where the providers were finding out that day they had a fever, one of their kids had a fever, and they couldn't go in to work. But it was very disruptive. And then when it happened twice, I thought, this practice isn't handling the pandemic. Found another recommended practice and got in and out no problem. So, an example of it can be the same discipline. One practice is handling things fine, and the other one is just not. Same thing with hospitals. we're starting to see some outcome research that the chaos in the healthcare system is impacting our quality of care. So hopefully that will start to improve as the pandemic improves. But keep that in mind. If you have an extreme situation, you may need to look at trying to talk to your friends, find a provider where the office is less chaotic. I'm hearing for a lot of people they've got an urgent problem and they can't get anyone at the doctor's office to return the call. So they do the smart thing. They go over to urgent care and get their needs addressed. So keep that in mind as well. The urgent care clinics locally seem to be doing really well during this pandemic. I've been hearing all kinds of positive feedback and comments. Um, okay, some providers are not able to return to work after COVID. Before the pandemic, we were already starting to see in this Philadelphia region for the last couple of years a healthcare provider shortage. That has to do with the aging population. Many of the providers themselves are baby boomers, so they're approaching um, retirement age. And there's a lot of doctors, healthcare providers that are in the baby boomer age, and there aren't enough coming up behind them to fill all those slots. So we were already looking at some provider shortages locally, and then some providers who maybe were planning on retiring in 2021 anyway, 2022, many of them, just to get out of the fray of the pandemic, did retire in 2020. So just something to keep in mind. And I'm surprised when I hear from my patients, oh yeah, the best whatever specialist ever got COVID, can't come back to work, so I'm working with their practice. And then the comments, just try getting a telephone call returned, and you can understand why they're chaotic. But we're gonna start to hear more and more about this, and I give the physicians credit who feel comfortable telling their office staff it's okay to let my patients know this is the reason why I'm not available. Because as providers, we have a right to, that's private. We don't have to let anybody know. We can tell them, I don't know, we won the lottery and we're like in the on a Caribbean island or something enjoying life. You don't have to share your information, but so this information that I'm learning about providers, and I don't know what percentage of providers are going to find themselves retiring early last year, this year, and next year. So that's going to be an impact as we move forward. I mentioned that significantly fewer families are leaning on long-term care facilities. I'm going to be talking about that more in the March 21st video about what can I do. The question there is how can I start planning for my in-home care needs. So I think that that is going to be a trend that is going to continue. The reason for that now, it's not that we don't have the same number of people needing the same care. It's what the issue is that there are enough other people who are either furloughed out of work or their business shut down that they're available to provide some of the care, or at the minimum, they're available to supervise the home health care coming into the home to help with the care for the senior. So I'm going to be talking about how we can start rethinking that as we move forward. And I think that's going to be a trend that continues. I've been surprised some of the local long-term care facilities, not just the nursing homes, but the continuum care facilities, are advertising, oh, we'll give you a virtual tour. Okay, good. They're advertising. They're trying to get people to come in because some people may, I don't know, have a major medical crisis and just have to go live at a facility to receive the care. But that sends a message loud and clear. If you place your loved one here, we don't know when you're going to be able to come in for a visit. Also, the COVID outbreaks are continuing in these long-term care facilities, and you can ask about that. They'll tell you because they have to. And the good news is they're continuing with the weekly testing of all the staff and all the residents, and then they're quarantining as soon as it gets picked up. Some may argue that's why it's getting picked up because they're getting tested. So the problems in long-term care with the COVID are continuing. Again, just about all the residents have been vaccinated, and the staff so-so, many of them exercising their right to refuse vaccination. Okay, and finally, fewer people are, oh yes, no, it's actually more of us. This is something we're going to have to plan, especially after those of you get duly vaccinated. You're fully vaccinated, you get both doses. Many of us for the past year have not been going to routine medical appointments. We've not been going to our screenings like our mammograms, our DEXA scans, our other healthcare screenings that our doctors like us to go for. And some of us are skipping some specialist appointments altogether. Others are kind of trying to fill in the patchwork with telehealth appointments. So, as we start to go back with those appointments, because we are going to have to start making those things up, it's going to be very important we do that. And so, I want everybody to start thinking about that. I encourage people, don't try to do it all in a week. If you get on the phone and you say, okay, I've got to schedule these four things, and every one of those offices saying, we got something next week, we got something next week, pace yourself. I say one appointment a month. You don't want to get overwhelmed trying to run to all the different appointments that you're making up from a whole year. Some of you might be like me as well. I mean, I have the oil company is called twice, I think 6 months apart in the last year. You, like, ma'am, you paid for this service contract. We'll come in with our masks and get it taken care of for you to get the furnace cleaned. And I said, I'm waiting until I get vaccinated and then I'll call you back. So hopefully that'll be sooner rather than later. So some of the local household maintenance, having people come in, um, repairs, remodeling. Some people have been remodeling their homes, comfortable with that, and that's fine too. But just as we move forward, once we start getting vaccinated, let's pace our safe selves on that and resist the urge to get everything done a week later, because it really don't pressure yourself. Some people are going to feel pressured. Look, I didn't do this, that, and the other. Got to get it all done. Pace yourself. Okay, so yeah, so that sums it up. Um, so I got through 10 episodes of the Dish on Aging. This has been such a joy for me. If somebody told me even 6 months ago that I would be putting together a video YouTube channel, I would say you're out of your mind, because I did not have the technical skills. So I'm learning things little by little. And this has actually become quite fun for me as the weeks go on. And now I'm thinking about, themes and how I can kind of step it up a notch to try to make identify. I'm going to start doing some research on the internet to try to identify some specific resources locally. And I know a lot of people are doing that. I know the AARP website is doing that. I know that there's a lot of information out there. I know a lot of local news channels are pushing people to internet social activities that seniors can participate in to try to get over some of the challenges that we have been facing. So I'm going to try to kick it up a notch as well in the month of March, and I look forward to seeing you all then. Take care. Have a good week. See you next week. Bye bye.